Good afternoon. My name is Ashley Hoffman, and I'm going to be speaking to you about the Health Insurance Portability and Accountability Act, otherwise known as HIPAA. So the purpose of HIPAA is to ensure privacy and security of people's health information. It includes all aspects from storage, disclosure, release, and disposal of those records. The people that have to comply with HIPAA, that includes health plans, healthcare clearinghouses, and healthcare providers who conduct certain financial or administrative standards, even if they contract with others, which are also called business associates, that assist in them performing those functions. The patient information that is protected by HIPAA includes the patient's name, date of birth, address, social security number, any of their present or future physical or mental health conditions, surgeries, provisions of medical care, all their payments that they've made, past, present, or future, like what would be due. As far as our department policy for communicating patient care to the ER, confidentiality is governed by the need-to-know concept. Only hospital staff involved in that patient's care or personnel involved in the quality assurance process are allowed to access that patient's records and reports. Authorized medical records and billing personnel are allowed to access to the patient's medical record and reports in accordance with the hospital and EMS providers' policies. The use of cell phones for communicating patient information in the hospital. So this is a big thing now because of technology, a lot of tablets, a lot of mobile Wi-Fi, and etc. So a lot of agencies are turning to those devices. Where the issue is the possibility of insufficient security measures. Any agency that uses any of these type of devices, they need to have a really strict policy in place and a really good IT department to ensure that the agency has firewalls, antivirus software, anti-malware, and authentication, password controls. The collection and sharing of pictures of emergency scenes that are relative to patient care and hospital staff. So, does this violate HIPAA? So, we have to be careful. Pictures can be utilized to help a diagnosing physician in the ER figure out exactly maybe what the patient endured, whether that's vehicle intrusion from an accident. Maybe it helps them see the rate of speed and the condition of the vehicle in which they were in, and maybe help them diagnose that patient, or maybe look for other injuries that may not exist externally. The pictures should be attached to the patient's chart, and they need to be deleted off those devices immediately. They're not to be shared. They should not be taken on personal devices, only on work-issued devices. You want to try to limit faces and things and other identifying objects or people's faces, just in case there was a data breach and these did get out. But it can be done. You just have to be really careful. So some of the consequences for failing to comply with HIPAA include criminal charges and fines that can be applied to anyone or any business that's found in violation with HIPAA. So it's definitely very serious, and it's definitely something that you want to make sure you have solid policies in place to protect not only yourself, but your employees and your business. So as far as our department and what we can learn from the scenario that was stated in the assignment, I've learned for us specifically, we do actually use a lot of mobile devices, but we are not as diligent in ensuring that we have the proper malware, antivirus stuff. I know that we do have password protection, but this is definitely something that has opened up my eyes that I need to meet with our IT department on and ensure that our devices, which we primarily use tablets in our ambulances, but that they're protected appropriately so that there is no risk of breach.